Almost there. Okay, and we are live. Hello, web shadowers. Thank you all for joining our session this afternoon. Today, we have the pleasure of hosting Dr. Pai, who will be teaching us about pediatrics. As always, please remember that the Google form will be posted in the chat box and in the description of this video at the end of the session. With that being said, Dr. Pai, you can get started whenever you're ready.
All right. Hello, everybody. Welcome to this session of Web Shadowers, and this is on general pediatrics. And the topic today is vaccine hesitancy. I thought that might be of interest to people, considering that we are in the middle of a pandemic and everybody's clamoring to get COVID vaccines, and here we are. So a little bit about myself. I am a general pediatrician. I did graduation from medical school in India. So I guess I am a foreign medical graduate for those of you who are getting applications put in for medical school. That's considered to be a different entity, but you go through the same residency programs as residents apply here through the NRMP. So I did my pediatric residency in Henry Ford Hospital in Detroit, Michigan. And then I was self-employed as a private pediatrician for a while, and then currently working for a multi-specialty group. I am in an office-based general pediatrics clinic, and I have a special interest in pediatric sports concussion. So I do see patients who are concussed in high school and younger age group as well. And we do neurological or neuropsychological testing here, computerized testing, balance testing. But that's just for another day, I guess. I practice in rural East Texas, and that's pretty much a little bit about me. As always, I like to do these basic disclosures, which most of you might be very familiar with. Any cases that I might discuss today are just examples. There are no real patient information that is going to be shared today. And my role here is mainly to talk about these topics in order to give an idea for pre-med students to get a feel for what general pediatrics and some topics in general pediatrics are. And at no point is it reflecting my positions, or not reflecting the positions of my medical school, my residency, or my current employer. So let's dive into the topic for today. So before we get started, a little bit about pediatrics. I see that when I look at Web Shadowers website, there's plenty of specialty groups and family practice presentations. So what is a definition of a pediatrician, and what does a pediatrician do, and what are the job opportunities? These are things that I think pre-med students need to know in case they are planning a career ahead, and pediatrics is one of the options they're looking at. So basically, a pediatrician is a medical doctor who specializes and manages the physical and mental health of children through the ages and stages of life, starting from birth all the way up to 18 to 21 years. So each word here, a little bit of significance. Medical doctor mainly means not a surgical doctor, so no surgeries involved, except maybe circumcisions in newborns. That's pretty much it as far as surgery part of pediatrician's life. Physical health, mental health, both important aspects of childhood. Ages and stages of life. Basically, a lot of it has to do with development, behavior, all the issues that are age specific. Pediatricians tend to spend a lot of time trying to navigate that and help parents navigate childhood. And then the age groups starting from birth all the way up to 18 to 21, depending on the comfort and knowledge base of each pediatrician. Pediatrician is not an OBGYN doctor, so he or she does not participate in the actual delivery of the baby. However, the pediatrician is usually around in case there is a complicated birth to help with newborn resuscitation, and that would be the birth part. What's the difference between a pediatrician and family medicine? That's a common question I get from medical students who rotate through here. So a pediatrician typically does the whole residency focus based completely on pediatrics. So there is no rotations that are involving adult patients. Compared to that, family medicine, family medicine physicians are trained to go all the way from birth to, geriatrics. So they tend to have maybe anywhere from 3 to 6 months rotations in pediatrics. So there's a big difference in the amount of training and specialization that a pediatrician does compared to family medicine. And most pediatricians take pride in that, because I think that having spent a whole 3 years training in the various aspects of pediatrics makes most of us feel very comfortable with complicated pediatric issues. The practice can be office-based, hospitalist, or urgent care. So once you're done with your graduation from the pediatric residency program, assuming you are going to not specialize further and not go into pediatric subspecialties, then you would be having job opportunities in an office-based practice, just like how I am doing it in an office-based practice, or you could work in a hospital as a hospitalist, and that would be a pediatric hospitalist. So these are people who are pediatricians who work in the hospital. They take call, they see patients when the patients are admitted to the hospital floor. They don't usually keep their own practice as an office base. They just work shifts and see patients only when they're admitted to the hospital. And they specialize only in pediatrics, so they see only children. So that would be a pediatric hospitalist. And then urgent care, those of you who live in bigger cities might have seen pediatric urgent care. So these are like a doc-in-the-box clinics where a pediatrician would be employed, again, a shift-based job opportunity where you would see patients, probably not to the level of critical care or emergency room medicine, but the usual bumps and bruises, sore throats kind of stuff. And you wouldn't have much continuity of care in urgent care setting. You would be seeing people as they come in to your business. You could end up having a rural practice or an urban practice. Rural obviously gets a little challenging. I practice in a small rural town, don't have any pediatric subspecialty support. So at times it can get a little challenging, but you tend to have more face-to-face time with your patients, very different kind of clientele, makes it very easy to have a long-lasting relationship with your patient population. Urban, practice typically tends to be very different because of usually the socioeconomic status or the education status of people, and then the number of choices that people have trying to see. And then as a physician, you tend to have more support structure by having subspecialty care that can help you out to see complicated patients, which you may not have that help when you're in a rural place. The other aspect of practice would be, you could be in a private practice, which is where I started. That would be like a person who just says, I'm going to go and start this all on my own. And everything from A to Z is going to be done by me. You hire people, you manage their salaries and human resources stuff. You manage the technology part of it, electronic medical records, all the rules, regulations, insurance. So that's a lot of heavy weightlifting to do, but in return, you tend to get the satisfaction of being able to make most of your decisions. Also, might end up being able to practice with your set of ideals or rules or ethics that you might want to follow. Group practice is what I'm doing right now, which would be in a multi-specialty group. You would be part of a bigger employer's health system. And you would be working along with your team of people, and you would have different specialties to help you around. And then an academic setting would be somebody who decides to do either research or go ahead and write papers or try to be teaching. I see a question here, and I'm just going to jump right into it. Why would children go to a family medicine doctor instead of a pediatrician? There's multiple reasons. One would be people who have their own physician as a family practice physician. They sometimes might feel that their kids would feel comfortable with the physician they themselves are seeing. So the parents might be seeing a family practice physician, and they may prefer to see have their kids seen by the same person. The other question I see here is what are the benefits of going to a pediatrician? And that's a very good question. I think that by virtue of having extended training program, which is completely focused on children, it's very evident that only the people who are very interested in focusing their career on children are going to be in that specialty. So most pediatricians by nature are very good at being patient advocates for children. Kids don't necessarily have the ability at younger ages to vocalize. You don't get much history from them. Sometimes there are difficult situations that the child may be having developmentally or socially or socioeconomically or in an abuse situation. Those are things that pediatricians are specially trained to catch early in life. I think that pediatricians are able to navigate through the different stages of development much better due to their training. And because of all those reasons, I think that there are definitely big advantages of a child going to see a pediatrician. Having said that, it's not always possible for everybody to go ahead and be seen by a pediatrician depending on where they live. Sometimes there might be a lack of a pediatric specialty in smaller rural areas. I remember when I came into this town, there were no pediatricians in this town for almost 8 to 10 years before I got here. So there are other reasons why people may choose to go to a family practice doctor. And it might not be completely because of their choice. It might be because of the location of where they live. All right, let's go the next slide. And we're going to talk today about vaccine hesitancy. So vaccine hesitancy, you can have different terms that are used. One would be anti-vax movement, anti-vaccination movement, anti-vaxxers. They all come under the umbrella of vaccine hesitancy. And vaccine hesitancy is essentially a reluctance or somebody who's refusing to get vaccinated or have their children vaccinated, and against diseases that we have protection. So this is not even getting into the COVID situation that we find ourselves in. It is diseases like hepatitis B or polio or diphtheria, things that we have vaccinations that have been going on for years, decades, and you may have a subset of people that you see in your practice who say, you know what, I don't want to vaccinate my child. And there are various reasons for that, but that whole group of people who have either hesitancy or who outright refuse to get vaccinated, those are the people we're talking about today. It has been identified as one of the top 10 global health threats. And this was in 2019. And it just so happens that we end up having a pandemic in 2020. And this topic becomes even more relevant in today's context. So most of the time, if you look at most of the things that you see here, the American Academy of Pediatrics, that's the AAP, and the CDC, which is the Centers for Disease Control, They would classify people into roughly two groups. You would have vaccine hesitant people or vaccine hesitant groups, or you would have vaccine refusal people, so people who are refusing vaccine. So let's go a little bit deeper into both those groups. Vaccine hesitancy would be applicable, the term applicable to people who are delaying their vaccination or spacing out their vaccination. They are not choosing to get their vaccinations as recommended by their pediatrician. And they are picking and choosing which vaccines they want to take. So they're saying, we don't want to follow this schedule. We want to do our own thing. Or why don't we do this in this sequence? And why don't we just not do this vaccine? So there's a lot of questions asked and concerns regarding the standard schedule that has been already approved, tried, and tested by these organizations like the AAP or the CDC. So those are the people who fall in the vaccine hesitant group. And then you have the vaccine refusal group, where you have people who are saying, no way, I'm not going to vaccinate my child, and those fall in the vaccine refusal group. We are seeing increasing numbers in these kind of groups, and unfortunately, it's not just restricted to one part or one country. We are seeing increase in numbers in pretty much most of the areas around the globe. So United States, Europe, parts of Asia. In Europe, there are countries like France and Netherlands, Belgium, which have a very high rate of vaccine hesitancy or vaccine refusal. So let's go to the next slide. So what are the characteristics of people who choose to vaccinate or not vaccinate or refuse vaccination? So some of the research has been very interesting. It shows that the fully unvaccinated, the ones who are completely refusing to be vaccinated, a lot of these parents tend to be coming from a higher income. So it's kind of counterintuitive, because most people would think, hey, these people have money, how come they're not vaccinating? Well, it so happens that most of the research points towards not vaccinating completely the group of people tending to be more higher income, more educated, and more often from a racial perspective tend to be Caucasian or white. So these are people who have full access to vaccines. They don't have any social determinants of health that are preventing them from having access to vaccinations, but they're choosing to refuse to vaccinate. So it is completely out of choice. So for example, somebody comes in, they have good commercial insurance, they have no problems with getting a ride to come to the doctor's office, they show up at the pediatrician's office, they usually will come up with some papers or something that is on their phone or computer that they have managed to look at, or something that they picked up from social media, and they will come in and they will refuse to vaccinate, not because they have no resources, it's just because out of their choice. So these are people who tend to be more fully unvaccinated children. And then you have the under-vaccinated group. So the under-vaccinated group tends to be more people who are actually having some difficulties. Usually there are issues on their social determinants of health. So for example, you would have people who are having public insurance. So that would be like Medicaid or CHIP program that our government provides, or people who are having no insurance, completely uninsured. There are people mainly from lower income, lower socioeconomic groups. Minorities tend to be more in this group, and then people who are having less education. So these are, in summary, people who are having limited access to vaccination or have social determinants of health working against them. A lot of times, this group you can work with, and you can actually get them to shift their position, and you can assist them, and you can educate them or get them into social programs or access to social programs that might actually make it easier for them to vaccinate. So this is a group that is near and dear to anybody who is a pediatrician who is interested in vaccinating as many people as possible, because this is a group that you can actually work with and you can have solutions. The first group, where it is a group of fully unvaccinated folks, those tend to be a little bit harder to deal with. It takes a lot of effort and time on part of pediatric providers to get them to vaccinate their children. However, it's not completely a lost cause. There are ways and strategies that you can use to assist to get those children vaccinated. So what are the common concerns that parents have when it comes to being like vaccine hesitant? So one of the things that you might look at, and you may have already knowledge of, is the 1998 study by a physician, or ex-physician, I should say, called by the name of Andrew Wakefield, and he published a paper in The Lancet. And in this paper, he made a link between the measles, mumps, and rubella vaccine, or MMR vaccine, and autism. That vaccination paper caused a lot of problems downstream. And eventually, it turned out that the information provided was completely inaccurate. And later on, Dr. Wakefield no longer ended up being Dr. Wakefield, because he was stripped of his medical degree by the United Kingdom. However, that caused a lot of downstream effect. And to this date, even after 22 years, people still will come in claiming that they have evidence. And one of the evidence that is pointed out is this study. So that's what this refers to. The other things that parents commonly have concerns about is preservatives. And we'll get into each of this in detail, but preservatives in multi-dose vials. So a lot of parents will have concerns about multi-dose vials having preservatives in them, and the vaccination program having all these additives in the vials, and that cause people to have concerns. So thimerosal is an additive that is used or was used in some of the vaccinations. Aluminum is one of the additives that used to be used in some vaccinations. So these are specific concerns that some parents may have. And there are strategies and conversation points that you can have regarding how to deal with these specific concerns, and there are resources that you can use to address these concerns. The other concern that a lot of parents have would be, hey, my kid's getting all these vaccines all at once. It's going to overwhelm my kid's immune system. How's that going to work out? And I'm concerned, or I'm like a complete naturopath. I believe in nature therapy, and I don't want artificial things to be injected in my kid's body. So these are some concerns that we hear from the anti-vaccine groups sometimes. And then you have concerns regarding simple things or common things like discomfort or pain. So you may have a kid or a child who's extremely sensitive, or a parent who's extremely sensitive to the pain that is caused by vaccination to their children, and may have concerns that, hey, I don't want to vaccinate my child because my kid's going to have some pain, and I can't watch my kid getting a shot or something like that. Occasionally, you have concerns about people having issues with effectiveness of vaccines, the claims that, oh, this is not a 100% safe way of doing things. And there are concerns that people raise, and that could be sometimes used as a reason to not vaccinate children. And then, of course, the last 12 to 16 months, I think everybody is well versed with all the various conspiracy theories that have been circling around in other spheres like politics. But here, specific to vaccination, there are a lot of conspiracy theories about vaccines causing some tracking mechanism for somebody. You go and put in, and that affects and that allows some person to have control or mind control over it. So there's all kinds of strange and unusual theories that are put forward. And then last but not the least, the effect of social media. So social media in more ways than one has taken over as a mainstream way of getting information. So a lot of people tend to get information from the social media, and there are people who post things on social media. So when people post things on social media, and if it's a group that you're extremely close to, or a closed-end group, it acts like an echo chamber or a silo. So people tend to just keep listening to who is on their social media. And if you have a bunch of people who are very proactively letting others know that they're not safe, or they should not be vaccinating their children, that can influence people who may be on the edge and might actually fall prey to that. So what are some strategies when it comes to talking about these things? One aspect is, there are many sources of information to tackle with each one of these problems and even more. A good resource is Children's Hospital of Philadelphia has a vaccine program that you have access to from websites. You can print the handouts that come from Children's Hospital of Philadelphia, and they do an excellent job of explaining the questions and the answers for each of these theories, or conspiracy theories and concerns. So anybody who is interested more in doing research on this kind of topic, I would direct them to that. But in very quick words, a few words about each of these things. So multi-dose vials, nowadays, in fact, I would say in the last 5 to 7 years, most vaccinations come in single dose. So we don't use a whole lot of multi-dose vials anymore. In fact, most of the common childhood vaccines come as single dose. So that makes it very easy to take that question or concern head on. And sometimes it doesn't hurt to actually show the vial to the patient or the parent and say that, hey, it's a single dose vial, so there is no preservative. That might be something that you might want to know. The other questions that usually come up regarding preservatives also has been addressed by a lot of vaccine manufacturers. So most of the newer vaccines are preservative free. They have that phrase put on the vial, so you can actually show that vial or the product insert of that vial and say like, hey, this is a preservative free vaccine. So that is another way to gain confidence from the parents. Multiple vaccinations and immune system, that's a common complaint that we hear amongst people who are having concerns regarding foreign elements or chemicals being put in the body and how it's going to affect the immune system. So one way to address that is to explain to the patient that our body, our natural immune system, gets challenged by numerous thousands, I would say, antigens or thousands of things that may be out in the environment on a daily basis. From the time we wake up till the time we go to bed, I think our immune system gets challenged multiple times. So our body keeps protecting us from having diseases or infections because it's working all the time. So when we vaccinate a child against a specific disease, what we are doing is trying to teach our own immune system how to recognize these diseases early on so that we can have a good immune response, and we are actually jump-starting the whole process for that specific disease. So when we do that, and we do that for maybe, let's say, for example, hepatitis B, that's just one antigen compared to maybe hundreds or thousands of antigens that our body is already reacting to without a vaccine when we are out there either playing in a park or playing with our dog. There's plenty of things that we get exposed to, and it's in some ways a natural vaccination happening without a needle. The pain and discomfort, there are ways and means to make a child comfortable. There are ways to teach the child to relax. There are ways to teach the person who is vaccinating, the nurse or the medical assistant, techniques to teach them how to make it as comfortable as possible for the child. And now the effectiveness, I think in some ways we are all a little spoiled because a lot of us expect everything to be 100% accurate, right, from the day one, or perfect from day one. And expectations need to be more in line of what we are able to achieve with vaccination. So I think it's important for pediatric providers to be very honest and say that most of the vaccines do a good job of making sure that the person doesn't get a very severe form of that disease, and it works in most vaccines, I would say, in about 80 to 90% of the time. So those realistic numbers and a way of trying to explain the success rate of the vaccine is a good way to motivate people to get vaccinated. I see a couple of questions in the chat box here, so I'm just going to jump right into that. It says, how do you handle a situation when an older child expresses a desire to vaccinate, but the child or the parent does not want the child to vaccinate? So that's a very interesting question. I think a lot of it depends on the age of the child. Also, it depends on the state that you practice in. Some states allow kids to have a little bit more leeway in making those decisions, maybe at 16, some don't. So it kind of depends on where you live. Now, the other question I see here is in ethics, how would you go about with the parent pushing for a waiver for vaccines? And that actually allows me to dive into the next slide because a lot of it will be covered on that one. So let's go right into that. So I guess a simple way to deal with this whole package of questions is to kind of put it in, how do you do counseling? Because at the end of the day, you might have different situations. One may be a person asking for a waiver. Another may be a person who is saying, I want to do only this vaccine and not that vaccine. Or you may have somebody else say, I'm going to come up with my own schedule. So there's different ways people present to the office and in a pediatric office, and one has to have a strategy on how are you going to deal with a person who is asking for a waiver, or who is asking for a change in the schedule or splitting the schedule. So you first have to start with the concept that getting the child even a single vaccine is better than getting a child no vaccine at all. So I think that the goal should be to obviously get as many vaccines to the child as the vaccines that are recommended for that age, but the goal should also be realistic depending on each situation. So in some situations, you may be able to convince the person to get all the vaccines, and some situations you may have to come up with a compromise. So if you start off with that premise, and the second goal should be to make sure to do it in a very respectful way and in a very elaborate method to build trust, then the success rate is definitely higher. So it starts off with asking, why would the person have concerns, or what concerns is the person having? And sometimes the solutions or the answers are fairly simple. So for example, there are times when I may be in an office visit and the person has a hesitation to vaccinate about maybe 1 out of 3 vaccines that are recommended. And it turns out that when you look in the chart, the person is paying for each of those vaccines and they have only so many dollars in their pocket or in their checkbook, and they are hesitant to give the third one because they are having some economic issues there. Those are situations that unless you ask, you wouldn't know, because if you were to just assume that, oh, they are refusing this vaccine, I don't want to talk about it, I'm just going to give them what they want or walk away, or that is a missed opportunity right there. So in that example, you would want to see if your clinic carries what is called Vaccine for Children program stock. So that's a government funded program which allows you to get vaccines from the government shipped to your clinic where there is no cost involved to get the vaccine from the state or the government program. And then you could in turn give that vaccine to that child and waive or not take the injection fee, and that would be a simple solution. Another solution would be to, in that situation, go ahead and direct them to a clinic where maybe the city or the county has a free clinic where they can just get vaccinations on demand, and that might be another way where you can assist that patient. So unless you ask, you will not know. And then, of course, you get into the situations where people have some specific concerns. So like, oh, I'm not going to give this vaccine because I read XYZ on the internet, or ABC told me this on my Facebook feed, or I am concerned about mercury, or I'm concerned about autism. In that situation, if you have narrowed it down from a very big group of being vaccine hesitant to a narrow situation where it is related only to one specific concern, that makes it very easy compared to just dealing it in an abstract form. The second strategy would be to actually allow the parents to go ahead and state their concerns in detail and in some ways validate their emotions. So a lot of parents, new parents especially, are having appropriate concerns about the safety and well-being of their child. And a lot of them might be new at parenting. So it is very obvious in those situations that they are concerned, they want what is best for their child, but the questions or the concerns about vaccines are motivated by their love and affection for the child. So once you flip it that way and you say, okay, well, I understand that you're concerned and I understand that you're caring for your child. What are the things that I can do to assist you to make sure that this child is getting the right care? And praising the parent for being invested in their child's health care is a way to make sure that you let everybody know that you and the parents are on the same team. You're not trying to be confrontational. You're not trying to bully them into making a decision. You want to walk with them to get to that decision. So that's another way to handle these situations. And in my experience, that usually gets you to the goal where you're trying to vaccinate the child. And then, child's health and well-being is usually on the top priority list for most parents. So once you go and make the link or emphasize on the link of how the health and well-being of the child is going to be affected by a lack of vaccination versus how it would be improved by vaccination and how that plays out, and you spell it out in very simple words without using a lot of medical jargon, you can tend to get more done that way. Motivational interviewing, and that technique I'm going to get into a little bit detail, but that is probably the one single thing that I think anybody who's a pediatrician should have some knowledge and some experience with, and it doesn't hurt to practice that on a daily basis, even in other situations which may not have vaccination involved, but are tense situation or situations which need a little bit of negotiation. And we'll get into that a little bit later, but that's the word, motivational interviewing. That's the phrase, and that's something that I would advise all of you out there to look at. Now, prescriptive and suggestive language. So, for example, kid comes in for 16-year vaccination. So you have meningitis vaccine that is given at 16, and that's a mandatory vaccine for school. But you have HPV vaccine, or the Gardasil vaccine as it's known, which is human papillomavirus vaccine, which is a recommended vaccine, but not a required vaccine. So if you phrase the premise as, let's go and get you your meningitis shot, and do you really want to have the HPV because it's not required for school? Well, that's one way to say the thing, and it's probably going to lead at least some people to say, I'm just going to need what's required for school. I don't want to deal with the HPV, and move on. The other way to say it would be to say, Well, it is highly recommended that you take the HPV vaccine, and we can do that vaccine right now while you're here to get the meningitis shot, which you already need. So why don't we just do these two and get you ahead and take care of everything for you while you're here? Well, that's a very prescriptive way. And I think that kind of boxes that whole situation in a way where if you have a good relationship with the family and the family has a trusting a relationship with you, you may end up having better success than splitting it into each and every vaccine and not being very proactive. As I said earlier, a compromise position is always better than no vaccination at all. So it's better to make sure that you look at where you're headed in that conversation, in that family, so that you are not trying to go for every vaccine to be said yes, otherwise I'm not going to see this patient. Some physicians tend to get into that space, and that's probably not very helpful to the patient, other than helping the physician's ego. I don't think anything good comes out of that. So a compromise position, working out a plan to go and get the kid finally to full vaccination status, but doing it in a maybe a different way, depending on each circumstances, is better than saying, I'm going to follow the CDC and the AAP guidelines. If you don't follow it, I'm not going to see you. You're fired from my practice. Those kind of things are in some ways harmful to the child, because at the end of the day, a pediatrician is the advocate for the child, and he or she has to manage the situation in such a way that the end goal is towards the well-being and good health of the child. And if you have that as your guiding principle, it's not very hard to imagine trying to compromise sometimes. You may end up having to do a little bit more than most other people. And then when everything else fails, you have to go ahead and get into what is called the AAP refusal of vaccination form, which is a standard form which the AAP recommends, and it has a lot of scary things which are possible when you don't vaccinate listed there, including death and disease. And if you go ahead and have a family sign that every time they refuse a vaccine, studies show that maybe at some point something will click and maybe they will change their mind. So that's when everything else fails, that's another option. And as much as possible, I usually recommend people not to dismiss a patient from their practice unless there is a serious distrust issue. But otherwise, I would advocate people to work with each family, look at their specific situations, maybe look at social determinants of health, and facilitate how to get the kid vaccinated. So a little bit about motivational interviewing. So motivational interviewing is something that you can get further information. There is a book by Miller and Rolnick. It's called Motivational Interviewing, and it's got a lot of research on it. But essentially, it involves respecting the autonomy of the family that you're dealing with, making sure that you're collaborating with them and not confronting them, and trying to work with them by opening them up with questions that are open-ended, having them have things that they feel comfortable talking about, rephrasing it in such a way that they feel that there is an alliance between you and the family, and then eventually making sure that you show some reflective listening. So you're listening to them, you're rephrasing some of the things that they're saying, and always showing empathy, trying to work, trying to get to the end result by working together, walking together with them. And then once you get that commitment from them to do a little bit, consolidate on that, and then reframe the whole situation, and then eventually get to where you want to implement your plan. So I kind of summarized a whole lot of things in one long blurb here, but essentially motivational interviewing is something that I recommend anybody who's interested to be a pediatrician to look into and have it as a core skill that they can use And that's a situation where if you know how to communicate using that method, you could use that in a whole lot of different situations. So I definitely recommend people doing that. So last but not the least, I just want to run through very quickly some examples of patients that I have encountered, and I'm quite sure other pediatricians encounter on a regular basis. So patient A shows up, this is just an example, shows up in your office, and she's got a baby who's 2 months old. And then she has 2 other children that she brings to you, and you have seen those children and they are fully vaccinated. And then she comes to you and she says, you know what, I read XYZ things on this platform, social network platform. I have all these concerns. I'm very hesitant, and I have decided I'm not going to vaccinate these children, this child. And if you go ahead and spend a little bit of time with that person, you go ahead and talk about the 2 children who have previously been vaccinated, talk about her experiences in those 2 situations that have happened prior. And some of it might be negative, but most of it might be positive. And then you go and explore it a little bit in detail. You can lay the path to eventually getting that person vaccinated. Because what would happen is you would go ahead and be able to say, hey, you know, it worked out well for these kids. Maybe you can go ahead and try this for this kid now that you have had 2 kids who've been vaccinated. So that's a very mild, I would say, level of hesitancy, but something that you should not ignore and capitalize on it right at the 2-month visit when the first set of vaccines are given, so that if you can get that first set of vaccination done for that 2-month-old, now you have pretty much ensured that that kid is going to get vaccinated fully. But if you didn't spend that extra 5 minutes or 10 minutes on getting that questions answered, you could turn that kid into a completely unvaccinated kid, which would be a shame. Another example would be somebody who's called what we call a partial vaccinator. Somebody who comes in and says, I read this and Dr. Bob or Dr. John or some person who writes books has written it, and he or she has said that you know, this vaccine schedule is not right and my vaccine schedule is right, and those are often manageable by working out some kind of a compromise. You may end up not getting everything that you want. They may not end up getting everything they want, but eventually you can come up with a pathway to where you can still have full immunization by the time they reach school age. These obviously cause a lot of stress to the office and to the nursing staff. Another easy tool is to use your electronic medical records, and once you come up with a plan, go ahead and write that down in some note form that can be easily accessible to others, so that once you have a pathway to get to all the vaccines, then the nurses or the medical assistants can look at it. So for example, somebody who says, I'm not going to do it the CDC way, I'm going to do XYZ way, and then you come up with a compromise, you figure that out, hash it out, put it in paper, put it on the electronic record, so that next time they come in, you have that compromise situation already staring at you, so you know which ones are due or which one you agreed to. Another example, a case study or case example would be somebody who is saying, I'm going to go ahead and vaccinate only if I get in you know, this brand, or I'm going to get it only in this sequence, or this particular way, or sometimes it's by this particular nurse, and those are things that I think are definitely something workable. The most difficult ones are the ones where they have already made up their mind and they're refusing, and they're completely refusing, and you tried and you tried and you tried. In those situations, the only option you have is to use the American Academy of Pediatrics refusal of vaccination form. Every time you give it to them, make them read all this. It kind of goes in detail about all the bad things that could happen when you're unvaccinated. And eventually, at some point of time, something's going to have to give. So either the patient's going to turn and help to get their kid vaccinated, or you're going to end up getting fed up and not see them anymore. But those are far and few, in my opinion. I see a few questions here about cultural and religious views. I think that most cultures and most religions would want their children who follow that culture or that religion to be healthy and safe. And unless there is anything specific that they have issues with, you should be able to address it by using some of the techniques that we've gone through. There are ways where some states allow you to get a waiver, and that is an answer to one of the questions I see here earlier about how parents can refuse it. Well, some states allow the waiver. It would be nice to have some legislation that does not allow these waiver situations to come through. The COVID vaccine situation is unique in so many ways. So I'm going to try to stay more general here. So I'm going to go to the next slide. So what's my advice to all you future physicians? I am a big Kung Fu Panda fan. So here's Master Oogway saying, yesterday is history, tomorrow is a mystery, and today is a gift. So that is why it's called the present. So I feel that these last 12 to 16 months have been extremely hard for all of you and everybody else as well. But I think that if you are mindful and you are living in the present and you are getting adjusted to how life has changed for everybody, you shall be successful when you put in a hard day's work. And as long as you do that, I wish everybody all the success. Well, that's all from me. Thank you for attending. If anybody has further questions, I'll be more than happy to take those right now. And my email address is here in case somebody has further questions that they want me to go over in detail.
Thank you so much, Dr. Pai. We really appreciate you taking the time to answer our questions and present so wonderfully to us. There are a few more questions in the chat box if you would like to just take a few minutes to look at them.
Okay.
Thank you so much.
All right. So this one says, is it too late? At any point, is it too late to receive certain vaccines? What we have is a way to get kids vaccinated, which is actually made easy by the CDC or the Centers for Disease Control. So you can actually go to the CDC website and it has a way to catch up immunization. So whenever, and this situation happens fairly often in most pediatricians' offices. So kid comes in, he's come from a different state, or he's in a difficult situation, maybe in foster care, and he's had some family situation, financial situation, missed vaccines, whatever, and he needs to get caught up. So how do you catch a person up? Well, there is a set way of doing it. So you go to the CDC website and you look at the catch-up schedule. So there's something called a catch-up immunization schedule. So you look at the catch-up immunization schedule, and then you go and get the kid caught up in a timely and safe, effective way. So that is the standard of care when you have a kid who is behind on vaccines and you're trying to catch them up. Now, it is disease specific. So there are some diseases that are more prevalent in a younger age group, but not that common in an older age group. So let's say, for example, rotavirus is a good example. So the rotavirus vaccine is given in the first year of life. If you have a kid who's never had the rotavirus vaccine and you start seeing that kid at 2 years, the kids, past the age group where you would give that vaccine. But in a different way, let's say a person is 3 years old, never got his hepatitis B vaccine for some reason, and 3 years shows up at your office. There's ways and means where you can catch him up or her up on the hepatitis B vaccine. And the way you do it is you do it according to the CDC catch-up schedule, which is accepted by most schools and colleges, and that would allow you to get to full immunization status. How often do I see anti-vaccine parents changing their minds and consenting to vaccinations? That's a question I'm seeing here. I think that with the right effort, my experience, and again, maybe it's anecdotal, but my experience is that usually you can get almost 80 to 90% of the people change their mind. So it is actually not impossible to go ahead and get to full immunization. It needs a lot of time and effort. And the advantage that you have is if you have a long-standing relationship, which I do with most of my patients, because I've been in the same practice community for practicing for a long time, it definitely helps. The trust issue helps. But overall, I would say your chances of getting people vaccinated is much higher than people actually think what is possible. Now, of course, you're going to run into a few people who are going to be obstinate and who will refuse, but those are actually far and few. A lot of times there's a lot of fear and anxiety, and when the physician in place is able to bring a sense of calm to the situation and have a conversation that seems like it's a bi-directional conversation, a conversation that is a dialogue between two people, the success rate is very high. If it is a very short conversation, very authoritative, very confrontational, then of course the success rate is very low. So that's a good question. I see here, how do we approach a patient when parents claim that they got sick after getting vaccination last time and refused to get vaccination anyway? So it is not unusual for people to have some symptoms after a vaccine. Now, the question that the physician or the provider has to come to explain and understand is, are those symptoms or claimed symptoms a result of the vaccination process? Are they some kind of an allergic reaction? Are they something that is a contraindication to the vaccination process itself? And I think once you frame it in that context, then you can do the most appropriate thing. So for example, a person comes to you and says, you know what, I got this vaccine and I had a lot of redness in the local area and it hurts really bad and I felt really bad for a day, took some Tylenol, I got better, and I don't want this to happen to somebody else and I don't want to vaccinate. But that is a fairly easy one to handle, right? So you just tell them, well, that's a local reaction, that's not a contraindication, you should not have any fear of that, and you can reassure that parent. It may not sound like a big deal to somebody who's a teenager or a young adult, people in your age groups, but for somebody who's a parent who has a 2-month-old and has fever and local pain, a lot of people get very upset about that. So explaining that and explaining that, yes, there was a local reaction, accepting that, and strategies on how to handle that, and saying that it's not an allergic reaction, it's not a contraindication, will increase your success rate. Now, the same scenario, you may have a person who have a more significant reaction where the person had fever and looked sick for a day. You may want to actually have that person come in and check them out and make sure that they're okay and reassure them by bringing them in. And rarely, very rarely, you may have a person who actually had some kind of a serious reaction. So there are some vaccines that may end up having a serious reaction. And I think not have our mind closed to the fact that that is possible. And if it is that, where it is a serious reaction, there are listed contraindications to repeating that vaccine. One can refer to the listed contraindications to repeating that vaccine, and then you could end up saying, hey, your kid did have a serious reaction. So this vaccine should no longer be given to you. And usually they are in situations where somebody may have some allergy to some component of the vaccine, maybe some thing that is used to make the vaccine. Rarely, somebody may have an egg allergy, or maybe allergy to polyethylene glycol, things that are used to make some parts of the vaccine work better. Those kind of things may be actually a true reaction, and you may want to avoid giving those vaccines. So I would not put all of that in one box. I would tease it out a little bit, figure out which one of those three things are applicable, and then go from there and make it where it is easy for them to understand why you're doing what you're doing. So I'm going to take this one, and I guess then we'll have to wind up. It says, how healthy do non-vaccinated children tend to be versus vaccinated children? So basically, I guess the question is, what's the big deal when you're non-vaccinated? Well, it is a big deal. It is a big deal because you have diseases that could kill you. Right? As a child, you could get meningitis, you could get pneumonia, you could get serious infections, you could get polio, and you could end up being seriously sick, or you could die from them. So you have this wonderful gift that science has provided, which is called vaccination. And it's not 100% perfect, but it is the best tool we have to make sure that people don't get these deadly diseases when they're a kid or a young kid. So that's the answer right there. So why would you take a chance? So it's like wearing a seatbelt. Yeah, you can drive the car without a seatbelt, but if you have a seatbelt, you have airbags. It's better to drive with a seatbelt and a car that has working brakes and airbags. Can you drive a car without any of those things? Sure can, but the risk is higher. So it comes a matter of risk tolerance. In general, I would think that an unvaccinated child would be taking in a lot more infections, not necessarily all of them deadly or causing serious illnesses, but definitely getting more infections. And that is completely avoidable. Some of the things may not be as bad, but could still cause serious problems. So for example, somebody who gets a pneumococcal vaccine in childhood, that pneumococcal vaccine not only prevents you from getting serious cases of pneumonia, but it also prevents you from getting serious ear infections. So a lot of kids who get repeated ear infections or tend to have problems with hearing and may have problems with their eardrum or their long-term hearing. So yes, you could go ahead and go ahead in life and be unvaccinated, but then you could end up having recurrent ear infections and be deaf. You may not die, but you may be deaf. And why would you want any child to be deaf when there is an easy solution, and you just take the vaccine and go from there? Now, it is definitely a bigger question when you have newer vaccines, and there's a lot more explaining and understanding to do when you have vaccines like the COVID vaccine, which is relatively new. And I can appreciate people having questions about that and going into the depths of it. But the childhood illnesses, the vaccinations that have been there for such a long time, tried, tested, doing such a good job. In fact, when I see medical students rotating through my office sometimes, a lot of them have not seen meningitis, or they have not seen meningitis caused by Hib, or they've not seen meningococcal meningitis. The reason for that, or they've not seen polio. I mean, there's a lot of kids, a lot of physicians who've probably not seen polio here. The reason for that is vaccination. So one of the virtues of having vaccination available and accessible is that it allows you to diminish some of these diseases in such a meaningful way, and allows everybody to have a healthy life. And that would be my message to everybody.
Thank you so much once again, Dr. Pai, for this amazing presentation and for staying a little after to answer our questions. We really appreciate it. For everyone still watching, the Google form has been posted in the chat box, and that'll be open for another 30 minutes. And once